my God, I don't know what has happened, but this is something awful, terrible.
I do remember our daughter and son were playing. I left, house was happy. I came back, house was empty. There was blood everywhere.
Around the corner comes our son, who has a white shirt on, and seeing he has this big red patch on his shirt. And I look, and by the time I look, the entire shirt was dark red. So hopefully we can get him stabilized and put him on a helicopter to Birmingham. So that, in my mind, went from, this is a very bad situation, to, I mean, we can't even fix it here. Holy.
We didn't talk about him dying, but we did talk about maybe he wouldn't have that arm, or, and at the time, I mean, as long as he survived, I felt like that's okay. We can deal with, that'll be fine. And then he had his life-saving surgery that night to repair his artery.
This is your kid. What do you do? And asked about 7 different people that from different phases, and friend does hand transplants and neurosurgeons, and remarkably, we said, all right, please give me 3 names, and that way we could look at all these different people. And every single list had a variety of names, but every single list had Dr. Moore on it.
When I saw Byron, and I could tell, on his exam where he was tender, and the pain that he was in, that combination with lack of function, I believed I could help. The work that Byron needed was on a high level of complexity, because it was a previously operated field, because the glass had transected multiple structures, because he had had the blood vessels reconstructed. I was going into tiger country, and the time, the tedious part of the procedure, and also the experience of knowing I can do this despite how hard it is. I think for Byron's sake, it is one of the most complex, high-risk, great reward procedures that I do.
Her surgical plan sounded much more hopeful and comprehensive than other surgeons we had talked to.
She's really great, and she'll always check on you, and she's really kind.
I really focus on that relationship with my patient, with the family, because it also gives me back my joy and why I went into medicine in the first place.
But it could have gotten so many different, it could have gone a really, really horrible, tragic way, and it didn't.
To go from there to where we are today is just incredible.
To actually see the fingers on the piano moving with the dexterity that I know he didn't have before our surgery. And that experience, and in the time of even seeing him, want to show me and be so proud of what he's gotten back, I think there's nothing better. There's nothing better that you could ask from me, to see him doing what he loves to do.
I'm just grateful. It has deepened my gratitude for our health and well-being, every day. Having had a child who came so close to dying, it gives me a perspective that I lacked before this.
So grateful to be sitting here today saying our son is strong, healthy, incredible person, and I think by going through the process, it's just sharpened his character and made him just a really wonderful kid.